Welcome to the 2022 annual community briefing for the Hazelwood Health Study. I'm Michael Abramson from Monash University. I'm the principal investigator of the Hazelwood Health Study. At this point, I'd like to hand over to Bridget Borg from the Alfred Hospital, who leads the adult respiratory stream.
Thanks, Michael, and welcome everybody. First up, I'd really like to thank the participants and the Latrobe Valley community for their continued engagement in our study. So in terms of the respiratory stream, what we've been doing over the last 12 months is continued analysis of some of the data from the first round of clinical assessments that were done in 2017 to 2018. Last year, we collected more clinical data as part of round two, which was interrupted a lot by COVID lockdowns, but we did get it completed sort of mid-November last year, and we've started data analysis there. And recently, Tyler, who's going to speak after me, has started collection for the long-term respiratory study and eating survey. In terms of round two data collection, you can see from the numbers here on the screen that in round one, we had about 346 residents of Morwell participate in the study and 173 from Sale. In round two, the numbers were a little bit down. Participants who had participated in round one were invited to come back for round two. We had 217 Morwell residents participate in round two and 112 from Sale. So it was about 64% of the round one total that came and participated in the round two data collection. So in round one, just as a reminder, we found that exposure to increasing levels of mine fire smoke was associated with less stretchy lungs, higher prevalence of COPD like lung function in non-smokers, so more airflow obstruction in non-smokers, and worse asthma control. We haven't finished analysis of the round two, but preliminary analysis is suggesting that exposure to increasing levels of mine fire smoke may no longer be associated with changes in lung function. So this is similar to the ALF study findings. So it could suggest that there may be some recovery of lung function changes that we saw in round one, or like the ALF study and phase suggestion, it could also be because we had lower numbers attend the round two data collection visits. So these results need some confirmation, and we'll be releasing those a little bit later this year, we hope. So in terms of future plans, we still have to complete analysis of the round two questionnaire data, which this time was collected online as opposed to interviewer based at the time of the clinic visit. And we also need to commence planning for round three data collection in 2023. So that is just about to get underway. And we're hoping that next year we'll be returning to the Latrobe Valley to recruit and collect some more data with clinical visits so that we can have a look and see whether we have continued improvement, if that's in fact what the round two data shows us, or whether there are further changes in lung function in the participants that we've looked at. I'll now hand over to Tyler Lane, who will discuss the long-term respiratory study.
Great, thanks very much, Bridget. So we're going to ask some follow-up questions of people who participated in the adult cohort survey. And what we're interested here is to learn about the longer-term effects of smoke exposure from the mine fire. And our primary objective is to understand, 8 years after the fact, do people who have had more smoke exposure have more respiratory symptoms? An earlier survey, which was about 2016, 2017, the adult survey found a higher prevalence of cough and phlegm, and I think one or two other outcomes. And we want to see if some of those have been sustained or if others have emerged in the meantime. But this is also an opportunity to take a cohort that was established before other events occurred and see whether these have had an effect as well. And the first of those is more smoke exposure from the Black Summer in 2019 to 2020. What we're wondering is whether this added effect of more smoke has worsened respiratory symptoms. Now, the Black Summer didn't hit Morwell as hard as the Hazelwood mine fire did, but there's still a reason to suspect that the combination of the Black Summer and the Hazelwood mine fire exposure could lead to more respiratory problems. The other big event that has occurred since the initial survey is the COVID-19 pandemic. And what we're interested here is in two outcomes. One, whether smoke exposure from the Hazelwood mine fire has increased people's vulnerability to COVID. So not just a greater likelihood of infection, but also severity of that infection. But in addition, we want to see whether exposure to the mine fire and COVID combined is predictive of even higher proportions of respiratory problems. The last thing we'd like to do with the survey is to see whether eating habits can influence respiratory problems among people exposed to smoke exposure, specifically whether it offers any protection. There is some emerging evidence that diets that are higher in antioxidants may offer protection. Well, maybe not protection, but they reduce lung function decline that happens to all of us as we get older. So what we are wondering is, do people who have better diets have some sort of defense against respiratory problems that emerge from the smoke exposure? So the survey that is addressing these questions has been in the field since mid-August. We're hoping to wrap up by the end of this month, maybe a little bit later as we follow up with some more specific questions. And we've interviewed approximately 600 people so far. As well as this survey, we have done a bit of other work on a review of evidence on air pollution and COVID-19, and more specific than air pollution, fine particulate matter. And what we're finding is that the fine particulate matter specifically seems to be linked to higher risk of COVID infection, at least when measured concurrently. We don't have evidence from previous exposures, years past, so this will be addressing a new question. There is some weaker evidence, but still somewhat convincing that this small particulate matter, fine particulate matter, increases the severity of COVID infection and also the likelihood of mortality.